My name is Thomas. I'm currently a second-year resident at Mount Sinai Hospital, specializing in internal medicine. And we do see patients in the outpatient clinic, and I've seen a lot of COVID patients and have prescribed sort of Paxlovid to a lot of patients myself. So really happy to sort of continue the efforts both on sort of Paxlovid, but also vaccination efforts, continued vaccination efforts against COVID. But today, really the objective is to look at Paxlovid as a medication and looking at its use, its sort of side effects, who's sort of qualified to get it, what are the sort of thoughts around why it works, when it works, etc. So this is sort of a one-pager summary of what Paxlovid is. It's an antiviral pill for COVID-19. It's intended for people who are quote unquote high risk for severe disease from COVID. It's taken within the first 5 days of symptoms, and it's meant to lower your risk getting so sick from COVID that you need to be hospitalized. Paxlovid is the brand name. There are two medications they're both antiviral medications. One is called nirmatrelvir and the other is ritonavir. And how do they work? They really just block the protein that viruses use to multiply. And is it FDA approved? Yes. That means our Food and Drug Administration have run many tests and trials, and they fully approved it for sort of the use of COVID in May of 2023. And even before then, it was used as early as December of 2021 when it was granted sort of the emergency use authorization. So it's been approved and it's safe and it's efficacious, and the manufacturer is Pfizer. So does it work? In a word, yes, it does. And sort of broken down into the types of patients, it works for both unvaccinated as well as vaccinated patients. This is sort of just a screenshot of some of the trials. There's a lot of words and it's a busy slide, but what the takeaway is, if you're unvaccinated, studies have shown that it reduces your risk of hospitalizations and death by about 86%. And if you're vaccinated, or if you previously had COVID, studies have shown that it also reduces your risk of hospitalizations by about 51%. So the takeaway here is that it works, and it works really well. The question is, who should be taking Paxlovid? It's not for everyone. You must be at high risk of developing severe COVID, which means some of sort of these risk factors that I listed here, but it's not a comprehensive list, but it's sort of general qualifications for COVID. If you're older, especially if you're older than 65, but if you're older than 50, that's a qualification factor. But technically this drug is approved for anyone above the age of 12. Other pre-existing conditions like cancer, diabetes, heart disease, pregnancy, or anything that causes you to have a weakened immune system, all these diseases can put you at higher risk of developing complications from COVID, which is really the reason why Paxlovid is prescribed in the first place. If qualified, we saw the data in a slide before, it would benefit both vaccinated and unvaccinated people. If you have any questions or, uncertain whether, you qualify or not, your doctor is and will determine whether or not you should take Paxlovid. The above are just general guidelines. Ultimately, your doctor makes that decision for you. And lastly, it is important just to remember that if you're young without pre-existing conditions, otherwise pretty healthy, Paxlovid may not be beneficial for you. So the doctor may say, hey, you're otherwise pretty healthy. I don't think you need it. We just need to, make sure you get rest and make sure you're isolated from other people for a certain number of days, and then kind of go on with your daily life as usual. The next slide is really just a reminder of when Paxlovid should be taken. It should be taken within 5 days of developing symptoms. And for those of you who have had COVID, you probably remember some of your symptoms like fevers, chills, cough, shortness of breath, etc. I had COVID a couple of years ago, and I remember the loss of taste, the headache, sore throat, all these things. You may have one or two, you may have all of them. These are non-specific symptoms, but sort of just a reminder of if you have some of these symptoms, go to your doctor, get checked, and then if within 5 days of symptoms, you may qualify for Paxlovid. Now that you're prescribed Paxlovid, how should I take it? It's pretty easy. This on the right is an actual picture of what Paxlovid looks like. It's 3 pills. You can see 2 of sort of the pink ones, and then 1 of the blue one. And you take all three together 2 times a day. So the first in the morning, the second at nighttime, for a total of 5 days. So when you get prescribed, you're given 30 total pills and you finish it within 5 days. And it's packaged in a very easy to administer, they call it a blister pack. So it's easy to know when you should take it and how many to take. And a lot of patients ask, this all sounds great. What are the side effects? And it's a really important question to ask, not only for Paxlovid, but in general for all medications with your doctor. The good thing is it's generally very well tolerated, meaning patients don't really complain of major side effects. When they do, some of the most common side effects, a metallic taste in your mouth that usually go away after time, and then diarrhea sometimes. Other side effects, possible side effects, I kind of included here as reference, but really uncommon to experience some of these symptoms. But possible allergic reaction, possible increased blood pressure, possible muscle aches, possible nausea, just to name a couple. But again, very uncommon. If you have kidney disease or kidney problems, no problem. You can still take it. The reason is that our kidneys are a vital organ to help filter the blood and also clear a lot of the toxins, but also medications. And if you have kidney problems, there's different dosing of Paxlovid that you can get prescribed to make sure it's not a harm to your kidneys. That's a broad overview of Paxlovid, but sort of just taking a step back, the key is still vaccinations. This is sort of just a reminder of what the current recommendations are. So I provided a link at the bottom for exact recommendations depending on your age, previous vaccinations, etc. But as a general overview, every adult 12 years or older should get one dose of an updated COVID-19 vaccine. And that's sort of the 2023-2024 formulation. There are 3 different types of vaccinations. One is the Pfizer one, the second is the Moderna one, and the third is the Novavax one. To note, the Pfizer Moderna, that's just one shot. The Novavax is 2 doses. And then if you have a child less than 12 years old, please talk to your child's pediatrician. And then if you're immunocompromised, also talk to your doctor regarding which vaccination to receive. And then this is just a reminder, if you have any questions at all, your primary care doctor can tell you more about Paxlovid, whether or not you qualify, whether or not you benefit from it, what vaccinations you should have, or whether or not you're up to date, or about COVID-19 in general. And this is sort of just a plug for the clinic I work at. It's Mount Sinai Internal Medicine Associates. It's a primary care office. We take care of patients in the Upper East Side, East Harlem. It's located on 17 East 102nd Street on the intersection of 102nd and Innocent. That's our phone number. We take more than 30 insurances, including Medicare and Medicaid. If you don't have a doctor or you'd like to switch or you are interested in being a patient of ours, I included our website as well as my personal card and telephone number. We're more than happy to accept new patients. Overall, that's sort of the overview on Paxlovid. I encourage people to think about Paxlovid if you've had vaccination as a second layer of defense. The vaccination is really your first layer to prevent getting the disease, but if you get it, that second layer is to prevent severe disease. And some doctors may be, if there are maybe borderline decisions, given that Paxlovid is one, a very safe medication, two, a very efficacious medication, and three, a medication that's only administered over 5 days, they may say, hey, you may not qualify based on these sort of qualifications, but I think, in my opinion, it may benefit you. So I'm just going to give it to you because there's really no downside and there may be an upside to added protection.
Paxlovid is such a good medication, like we've talked about. It's becoming much more flexible about prescribing it. And even pharmacists can often prescribe it too. If you have basically any diagnosis, even if you have anxiety, you can, that qualifies for it. But even a lot of people will still prescribe, even if you don't have any diagnosis or you're completely healthy, but you have a lot of evidence that you have COVID and you're just unvaccinated or not up to date with your vaccinations. That's pretty much enough for people to prescribe Paxlovid.
There are other oral COVID pills that's not Paxlovid, can be alternatives.